Well, what about heat on the other side of the spectrum? You know, we've used heat for years and years as well. And there's actually some research out there that shows, particularly in low back patients, that using low levels of heat for long periods of time is an effective pain reducer. It's, again, one of those superficial modalities that we sometimes take advantage of, which does have some issues as well, like burning and other things. But how do you use heat in your practice?
Yeah, I still use heat in my practice for sure. I think things like pain modulation, again, is a huge thing. Decreasing somebody's muscle guarding, and specifically in cases of low back pain, I find that ice tends to make people a little bit more stiff at the low back and actually sort of exacerbate their pain with certain low back diagnoses.
Right.
So I find that heat, specifically at the low back, does tend to clinically work better. So that's interesting that we're seeing that in the research.
Yep, that's right.
So yeah, I think there's still, again, there's a time and a place for everything when it comes to modalities within our practice, whether it's our hands or a tool or whatever you're utilizing. And it really comes down to what is the therapeutic objective you're trying to attain, and what's the therapeutic modifier that you're going to utilize in order to obtain that objective. And I think heat is an appropriate therapeutic modifier that can have objective changes in a patient. And I think it's again, worth using, not to just toss it out because it's sort of been frowned upon. I think there's a time and place for everything. We know that heat generally feels good to people too, and so we've talked about before about the biopsychosocial issues that go along with pain, and sometimes simply just making people feel good, even if it's not a local thing or even if it's not a physiological thing, sometimes a mental thing. To me, there's value in that, and there's value for that in my practice, no doubt.
I think that's true of any modality that we do as clinicians, is it's selling it to the patient. If you went to the patient and you said, yeah, here's something that may or may not work, it's probably not going to work, particularly when you're looking at pain. Pain has those biopsychosocial issues. And we're getting bashed for the word placebo nowadays. Guess what? Placebo is a great thing, right? Especially with athletes.
Sure.
So what we need to do is embrace that effect of how we are presenting ourselves as professionals. We're selling these treatments to these individuals, and then letting nature take its course and make sure that we're doing everything we can to ensure the success of the treatment.
Absolutely.